Malaria remains a notifiable disease in the Philippines, even though cases have significantly declined in recent years. Malaria is caused by Plasmodium parasites, which are transmitted through the bites of infected female Anopheles mosquitoes. This marks it as a vector borne disease, closely tied to environment, housing, and sanitation. According to the Department of Health, the goal is a malaria free Philippines by 2030. This vision is part of the Malaria Control and Elimination Program, which focuses on surveillance, case management, and vector control. Population focused nursing must combine prevention, early treatment, and community participation. Three pillars that perfectly fit malaria control. In the Philippines, malaria is now limited to specific endemic areas such as Palawan, Sultan Kudarat, Mindoro, and parts of Mindanao. These are mostly forested, coastal, and hard to reach communities, places where healthcare access remains limited and mosquito breeding conditions persist. We call these indigenous cases, meaning infections acquired locally rather than imported. The decreasing incidence of malaria is a strong sign that our case detection and vector control programs are working. However, as long as even one community remains endemic, elimination efforts must continue. Public health nurses, therefore, play a vital role in reaching remote populations, ensuring that both prevention and treatment services are delivered even in geographically isolated areas. Malaria is caused by several species of the parasite: Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. Among all of this, Plasmodium falciparum causes the most severe form and is often associated with fatal cases. Transmission occurs through the bite of an infected female Anopheles mosquito, which typically bites between dusk and dawn. Once bitten, the parasite enters the bloodstream, infects liver cells, and eventually invades the red blood cells, causing these cyclical fevers and chills characteristics of malaria. Other transmission routes, though rare, include blood transfusion and congenital transmission from mother to child. Understanding these routes help us design more targeted health education and prevention messages, especially for pregnant women and blood donors. The classic symptoms of malaria are easily remembered: fever, chills, and sweating. These occur in cycles, as the parasites rupture red blood cells every 48 to 72 hours. Patients may also complain of headache, body or muscle pain, and nausea, which can be mistaken for flu or other febrile illnesses. That is why healthcare workers in endemic areas must always consider malaria in any fever case, especially after travel to affected provinces. In severe malaria, complications such as anemia, jaundice, or even cerebral malaria can develop, which may lead to seizures or coma. Early recognition and prompt treatment are therefore crucial to saving lives and preventing transmission. Diagnosis should always be laboratory confirmed. The gold standard is microscopy, where malaria parasites are identified in a blood smear. In resource limited settings, rapid diagnostic tests or RDTs are used for quick and accurate results. Treatment involves artemisinin based combination therapy or ACT, which effectively kills parasites and prevents drug resistance. Other supportive measures include hydration, fever management, and monitoring for anemia. Community based disease management is effective only when combined with early diagnosis. Thus, early testing and treatment not only prevent complications, but also interrupt the transmission cycle within the community. Vector control remains the cornerstone of malaria prevention and control. Key strategies include indoor residual spraying or IRS and distribution of ITNs or insecticide treated nets. IRS kills mosquitoes resting on walls after feeding, while ITNs provide personal protection at night, especially for children and pregnant women. Environmental management is equally vital. Activities such as drainage, larviciding, and removal of stagnant water reduce breeding sites. But even the best vector control will fail without community participation. When households take responsibility for maintaining clean surroundings, the risk of malaria transmission drops dramatically. According to the DOH, provinces that have achieved malaria elimination all demonstrate strong community cooperation led by local health teams. Prevention begins with simple protective measures that families can adapt every day. Using mosquito nets and repellents during nighttime is essential, especially in rural areas. Wearing protective clothing such as long sleeves and pants provides added protection against mosquito bites. We also remind residents to avoid staying near stagnant water areas, especially during dusk and dawn when mosquitoes are most active. For travelers to endemic zones, prophylactic medication may be recommended. Nurses must provide accurate travel health advice to prevent imported cases. Public health education is central to malaria elimination. We nurses educate families about early consultation when fever persists for 2 days or more, instead of self medicating. We emphasize consistent use of bed nets and prompt diagnosis, reminding families that malaria is preventable and curable when treated early. Community seminars and barangay assemblies are effective venues to strengthen awareness and correct misconceptions about the disease. Education should always be participatory, rooted in local language, culture, and lived experience. When people understand that malaria elimination means a healthier, more productive life, they become motivated to sustain these practices. The public health nurse is a key implementer of the malaria control and elimination program at the grassroots level. We conduct surveillance and case investigation to identify and treat infections before they spread. Nurses also supervise community volunteers who assist with vector control, net distribution, and environmental sanitation. Equally important, we nurses lead health education and advocacy, translating our national goals into community action. We collaborate with local leaders, schools, and NGOs to maintain awareness, sustain funding, and ensure that elimination strategies are locally owned. Nurses bridge the gap between science and community life, making policies meaningful to the people we serve. To recap, malaria elimination depends on sustained surveillance and community cooperation. Even though case numbers have declined, one missed case can reintroduce transmission. Nurses serve as frontliners in prevention, diagnosis, and control, ensuring that every case is detected, every mosquito breeding site addressed, and every family educated. Through integrated efforts from local health units to international partnership, a malaria free Philippines by 2030 is not just a dream but a shared national commitment. As nurses, we stand at the center of this goal, proving that through education, vigilance, and collaboration, public health victories are within our reach.